Hip dysplasia is a condition in which the hips do not fully develop within the hip joint. This is something that is typically monitored by your maternal child health nurse. Occasionally, this can occur as a packing disorder, meaning it occurs based on how Bubs was situated within the womb, usually when the ligaments around the hip joint are loose. If the ligament looseness persists after birth, the hip joint may not develop properly or may even dislocate. Things to look out for include hips clicking or being stiff. If you have any concerns about hip dysplasia, please contact your maternal child health nurse, physio, or doctor. The best ways to prevent hip dysplasia from occurring include promoting hip growth and development. You can stretch your Bub's hips by bending their knees up and bringing their legs out to the sides. Hold for a few seconds a couple of times in a row. In this position, you put the most contact between the pelvis and the femur, and it stimulates the development of a strong and stable joint. Please note, Bubs may become quite vocal or appear distressed during this stretch, but it is not painful. If one leg appears to stretch further than the other, for example, one knee goes to the floor and one stays pointing at the ceiling, please contact your maternal child health nurse or physio to do further assessment. You can also ensure when you wrap or swaddle Bubs that you leave plenty of space for Bubs to kick and move their legs to further develop hip mobility. Other packaging conditions, such as positional talipes, where the foot points down and in or up and out, can increase the risk of hip dysplasia. So if your child has had positional talipes, please ensure that your Bub does get a hip assessment from your maternal child health nurse or physio. In some cases, if further concerns for hip dysplasia arise, they may require a scan such as a hip ultrasound or X-ray. And there are options to help with treatment, such as bracing to promote this hip development. If you have any concerns or questions, please ask your maternal child health nurse, doctor, or physio.